Surgery involving the orbit is delicate work. It's not just about repairing damage or removing a growth. It's about preserving sight when possible and maintaining the natural appearance of the face. The goal is always twofold: protect or restore vision and keep the anatomical balance of the eye and surrounding tissues. Orbital surgeries. These procedures may be done to repair fractures, remove a foreign body, or take out benign or malignant tumors. Orbital bones are realigned to their natural positions when fractures are repaired. Because the optic nerve, retinal vessels, and eye muscles are close at hand, even a small misstep can have lasting consequences. Sudden pain and loss of vision after surgery can indicate bleeding inside the orbit or optic nerve compression. Both require immediate attention. Temporary drooping of the eyelid or double vision can occur from muscle trauma, but usually resolves in a few weeks. After orbital surgery, patients are often given IV antibiotics to prevent infection, especially after fracture repair or foreign body removal. IV steroids may be used if the optic nerve is at risk from swelling. Topical antibiotics protect the surface tissues, and antibiotic ointment is applied to the skin sutures. For the first 24 to 48 hours, ice compresses help control swelling, and keeping the head elevated to about 30 to 45 degrees reduces facial edema. At discharge, patients are instructed on oral antibiotics, eye medications, and continued use of cold compresses. Enucleation and related procedures. Enucleation is the surgical removal of the eyeball while leaving the muscles and other orbital contents in place. It may be necessary after severe trauma in a blind, painful eye, in cases of sympathetic ophthalmia, or for untreatable intraocular tumors. The surgeon detaches the eye muscles, cuts the optic nerve, and removes the globe. An orbital implant is usually placed, the conjunctiva is closed, and a pressure dressing applied. Evisceration is a less extensive procedure. The inner contents of the eye are removed, but the outer shell, muscles, and sometimes the cornea remain. This often results in a better cosmetic appearance and prosthesis movement compared to enucleation. Exenteration is the most extensive, removing the eye, surrounding soft tissue, and sometimes eyelids. It's reserved for life-threatening orbital cancers or cases where no other treatment is possible. Ocular prostheses. After enucleation or evisceration, an orbital implant or conformer is placed to preserve the shape of the socket and prevent contraction. There are two main types of prostheses: anophthalmic prosthesis for sockets without a globe, scleral shell, thin shell that fits over an existing globe. These prostheses have limited movement, last around 6 years, and are fitted by an ocularist once the socket heals, usually 6 to 8 weeks post-surgery. Meeting with the ocularist beforehand can help answer questions and ease anxiety. Medical and nursing management. Losing an eye carries physical, emotional, and social challenges. Preparing patients includes explaining the procedure, the role of implants, and the options for prosthetics. Some patients like to consult an ocularist before surgery to discuss appearance and fit. Postoperatively, patients should know they'll have a large pressure dressing for about a week, with antibiotic ointment applied to the socket. Loss of depth perception will require caution with walking and daily activities. Conformers can occasionally fall out. They should be cleaned, dried, and replaced. If eye removal was unexpected, such as after trauma, emotional support is especially critical. Referrals to home health, rehab, or community services can help with the transition. Self-care and prosthetic handling. Patients must learn how to insert, remove, and care for their prosthesis. Hand hygiene is essential. Towels over the sink and closing the drain prevent losing the prosthesis during handling. Identifying marks help orient the prosthesis correctly. Insertion involves lifting the upper lid, sliding the prosthesis under it, and lowering the lower lid into place. Removal is done by pressing the lower lid down and allowing the prosthesis to slide out into the hand. Daily irrigation of the prosthesis while in place keeps it comfortable. Lubricating drops or ointments help with dryness. Discomfort, redness, or excess discharge should be checked promptly, as these may signal infection or poor hygiene. Key points. Orbital surgery aims to restore anatomy and protect vision. Enucleation, evisceration, and exenteration differ in how much tissue is removed. Prostheses restore appearance but require careful handling and hygiene. Emotional support and thorough education are vital parts of care.